Hi, Kevin Henry with Dental Economics. I'm here today on a Skype interview with Mike Uretz, who's a dental software advisor and a guru, I should say, when it comes to this. So, Mike, thanks for your time. I really appreciate it.
Oh, no problem, Kevin.
We're going to talk a little bit today about some of the technical aspects of the dental practice that maybe dentists often overlook. And, Mike, I guess first question I'd want to ask you is why should the dentist be so involved with the technical aspect of the practice? Why do you feel that's important?
Well, the one thing I've learned, Kevin, over a good 10 years, I helped a number of practices evaluate and select vendors. And I find, which is pretty normal, that the docs, the practice managers, the office managers, they focus mostly on what they see on the screens, what kind of features it has, what the clinical note looks like, things they can touch and feel. Okay, now I'm a little bit unusual because I've been in IT for 30 years, so I'm somewhat of a geek. And I've always believed that in addition to the features you look at, it's really important to understand the underlying technology. And I guess an analogy I use is, maybe it's a bad one, but if you were to buy a high-performance car, a Porsche, Ferrari, and then maybe put a VW engine in, VW Beetle engine, right? So the whole idea is people don't look under the hood. And you know that old picture you see about an iceberg where they show the 10% of the iceberg on top and the 90% on the bottom? The technology is really what you're stuck with for the next 5, 10 years, as long as you have it. So really, you don't have to be a geek, but it's important to ask just a few general technical questions to get a sense of what kind of efforts these vendors have put into the technical aspects.
So, Mike, talk to me a little bit about standard technology versus proprietary technology. What's the difference? What do dentists need to know?
That's a really important question and goes really to the base of a lot of this stuff. What you have to watch out for is a vendor holding you hostage, basically, because once you get their software, you're pretty much stuck with using it for a long time. If it's a proprietary technology, by that I mean, for example, the database structure is something that the vendor invented, is something that only they can deal with. Then you don't have the ability to do anything if they should go away. If they should, if you just want to leave them and go to another vendor, it's very difficult to migrate your database on a proprietary technology to, let's say, another vendor's database. However, if it's a standard technology, and maybe some of your viewers have heard of things like SQL database or Oracle databases, these are standard technologies. So therefore, if let's say after 3, 4 years you don't like the vendor you're with, you want to move and migrate to another vendor, and I've done this with a lot of clients, this happens a lot, then it's a standard type of import and export. So again, you want to make sure that whatever vendor you choose has some kind of standard technology behind it and not a proprietary technology. And so what will happen is as you get into electronic records technology, you'll have two choices. Everybody has a practice management system, which they've used for 30 years and they just hold close to their vest. But then you'll see electronic health record systems. So you'll have to make a decision. Do you like a different vendor's electronic health record system? And do you want to interface that with your present practice management system? Or do you opt to go with a complete, what's called an integrated system? So everything, practice management features, billing, scheduling, clinical features from the EDR, they all reside on the same database. Now, I will tell you that using maybe a medical model over 10 years of medical EHR, almost every vendor to a T has gone from interfacing their technology 8, 9, 10 years ago to now, if you look at a lot of the EHRs in medicine, they're almost all integrated in one platform. The benefits of that, of course, are the old cliche of the one throat to choke. There's no finger pointing. It's a lot cleaner having things on one database. So we'll see how EDR shakes out, but definitely ask that question to your vendor. Are they interfacing it or do they have an integrated system?
And we can't think about technology without thinking about contracts as well. So talk a little bit about what areas the dentist really has to think about when it comes to contracts and technology.
I'm glad you asked that because that's near and dear to my heart. I think too many times practices just turn over their contracts, their healthcare attorneys, which sometimes aren't experts in software. So what I will tell you is one of the main things that you want to look at is something called software escrow and data schema. I'm a techie, so I like to throw in very technical terms. But anyway, what that means is the data schema means that you should ask for a right in the contract to get the documentation of the structure of your database. And the reason that's important is because if your vendor ever goes out of business, if you ever hire a third-party software firm to plug in something, add some new software, unless you have that structure, then basically the vendor will hold you hostage. They are the only one that understands it. On top of that, there's a concept called software escrow in contracts. And what that is just like, when you, in a real estate transaction, somebody holds the escrow until it's done. Somebody holds the deal. There's escrow agents. And so what happens is all the intellectual property that your vendor has, their programming, their documentation, everything they have is held in escrow. And you have the right, if they ever go out of business, to be able to get that. So therefore, you're not stuck. You still have the ability to see their programming. And that's really important because I've seen too many times, we all know about software companies. They go in, they go out of business. No matter how large they are, they can change, they can be bought up. So those two things, software escrow and data schema, are important concepts to think about when you're doing your contracts.
And I know you've talked about software, and I know that you're also launching a venture, really putting something together online that can be a software resource for dentists. So you want to talk a little bit about that?
Oh, sure. I appreciate that. So kind of as a labor of love, what we've realized was that there's just not enough independent information on software technology, especially the growth of EDRs. And so what we're trying to do is we're trying to basically abstract the world of information and try to put it at the dentist's fingertips. And what we're doing is we're building a website called dentalsoftwareadvisor.com. And I really encourage folks to look at it. We're developing it, and I would solicit feedback. And hopefully it'll be a good thing as we grow. We really want to develop a definitive resource for this information.
So, Mike, if somebody has some software questions or wants to get more information from you on some of the things we've talked about today, where could they get a hold of you?
Well, probably the best way is actually get a hold of me at Mikeu, at dentalsoftwareadvisor.com. And that's probably the best way. And I've been doing this for a lot of years. I do a lot of education. In fact, that's my first love. And I think it's really important to educate practices on this new technology. So, please don't have any of your viewers hesitate to just give me a call if they have any questions on any aspects of this.
All right, Mike, hey, some great advice, and I really appreciate your time. Thanks so much.
Okay, thanks, Kevin. I appreciate it.